The See, Test and Treat is a wonderful event. It's an opportunity for patients who have barriers to obtaining health care, such as the Asian American community in Boston, to get the kind of treatment and cancer screening that they need.
By coming in for regular screening, you can pick up something that is maybe minor now, but had you not seen it on a screen or a preventative visit, something that could go out 3 to 5 years could now be something that's no longer treatable, where if we catch it soon enough, it could be minor.
That's why the College of American Pathologists teams with local hospitals and community foundations each year to help uninsured and underserved populations get free screenings for cervical and breast cancer that's essential to their health. The annual See, Test and Treat event has proved successful in the past, and one of this year's locations at Boston's Tufts Medical Center has delivered quite the same positive effect.
The See, Test and Treat program is extremely important in diminishing the barriers that women might have in seeking attention.
Especially in the Asian community, I feel like, for example, my mom, she would not come out to events like this unless I drag her. It's partly our culture, it's partly the way we feel about ourselves, our body.
It's also a way to introduce patients to members of the healthcare team who are usually behind the scenes. We have pathologists, radiologists, cytopathologists, cytotechnologists.
And that kind of exposure goes a long way within the community.
People around, everybody is nice to us, and they are trying to help us. So that's very, very, very good.
By coming here and meeting people personally, like talking to doctors who actually work here, who are volunteering themselves today as well, make it very personal. And so I feel that motivates us to come here more.
That motivation is essential because of the challenges that exist.
In particular, in our population, Asian American population, lack of insurance, the need of childcare, the anxiety of having to wait for a result, which in this case gets done the same day. And in addition, it allows for education.
They're amazed that the brochures are free and they can take them home with them and learn. We have the brochures translated into Chinese, which they appreciate very much because most of the people I've seen today have not spoken English.
An exercise instructor adds to the activities of the day by leading participants through stress-busting routines. The event is a great chance for patients to interact with all the healthcare professionals on their medical team.
Many people don't realize that pathologists are physicians, and they're physicians who diagnose cancer and other diseases by examining cells, tissues, and body fluids.
So it is, again today, a service for screening, but I think it's also a very important educational exercise for the public to see what pathologists do and how we interact with other physicians.
She can learn exactly what a pap smear is. She can take a look under the microscope with Dr. Lever and look at the cells and see what they're looking for. And I think the more educated the patient is, the more likely she is to continue to pursue what she needs for her own health.
And I think by having such a supportive community here from the doctors and the coordinators here, it made me really comfortable to really talk about what I don't know and what I want to know, what I need to know.
Most importantly, we get the results, I think, right away.
It's even more special for the patient because she's actually sitting down with her healthcare provider to discuss not only the results but the next course of action.
The event is the culmination of months-long coordination and collaboration from medical professionals across the board.
I think that Tufts always is very collegial, but this adds more to it. So it allows us to meet with all the cytologists and the pathologists.
This has been a wonderful opportunity to bring Tufts Medical Center, the Chinatown community, our radiology department, our colleagues from gynecology and OBGYN, pathologists, cytotechnologists, just all participants in the healthcare. In addition to community volunteers and support we've had from Susan G. Komen for the Cure, American Cancer Society, and certainly the College of American Pathologists.